teen boys have some manners. Look at that. I like it. Thank you, Kelsha. Sophia Turbide, a Geneva senior in our New Vision Medical Careers program, is also here to address the audience about her experience as a student.
Tonight, we celebrate students from all the Finger Lakes Technical and Career Center programs. This encompasses transportation careers like auto body repair and automotive technology, service industry careers such as criminal justice, cosmetology, and culinary arts, agricultural careers like animal and plant sciences and conservation, computers and communications careers, construction and fabrication careers, as well as the New Vision programs. With such a wide breadth of classes and programs, one may wonder what holds all these students, instructors, and programs together. I can see them clearly while looking out into this room. We all have two things in common: our hands. Some of you use your hands to help people feel as beautiful on the outside as they are on the inside, shaping precision brows and perfecting the perm. Some of you have a green thumb on your hand and will help to feed our nation. Others use your hands to create CAD designs and computer programs. Some of you use your hands to mince, dice, slice, chop, stir, knead, and stir up delicious and nutritious culinary creations. Many of you construct structures in which all of us will build our lives and call home. Others repair and maintain the engines, machines, and systems that keep our lives moving forward. As a student of the New Vision Medical Careers program, from the first day of class in September, I was taught to use my hand. In the first few weeks of class, we learned to take blood pressure by hand, used our fingertips to take the radial pulse of our classmates, and palpated bone markings like the tibial tuberosity on our own bodies. We became basic life support certified as we practiced placing our hands together into a perfect formation to perform chest compressions. We learned to use our hands to save a life. We practiced protection of our hands by donning and doffing countless pairs of yellow rubber gloves and singing happy birthday as we washed our hands seemingly infinite times. Once in the field, I realized that my hands, though less skilled and experienced, were just as powerful as any physician or nurses. Gloves have become my superhero cape. When I put on a pair of gloves, I'm able to learn by touching, holding, and experiencing. By placing my fingers on a new hemodialysis fistula, I could feel the thrill of blood moving through the new vessel like a tiny purring kitten. Perhaps the same type of thrill some of you feel when you hear the purr of an engine. I could feel the swollen lymph nodes of a man with an infection of the synovial fluid of his knee. With Dr. Dean, the pathologist, I held and could feel the textures of a healthy gallbladder, appendix, heart, and brain, and the variations of those with abnormal pathologies. I can tell you that livers feel spongy, gallbladders are slippery, and stomachs are ruffled on the inside. These nuances could only be felt and experienced. They cannot be learned by merely reading a textbook. Since being basic life support certified in September, I have done chest compressions during 3 medical codes, 2 with positive outcomes, and 1 where no one's hands could make a difference. Recently, one of my favorite mentors, Nella Peacock, a nurse practitioner who specializes in infectious disease, shared with me an important piece of advice. You must always look at your patient. Always touch your patient. One day, a physician I was following walked into a patient room to do a physical exam on a patient who, on paper, appeared to have had a heart attack. But when the physician felt her pale and clammy skin, she quickly found that she was failing from sepsis. I have held many hands in the past few months. A nursing home resident when we played bingo together, a man with quick tremors having an echocardiogram in the ICU, and a woman suffering from dementia and pneumonia while she had a breathing treatment. In these instances, my hands were vehicles for comfort, emotional support, and compassion. My hands literally serving as an instrument of my humanity. This year, my hands have become my greatest tool. The strength of the technical and career education lies in the fact that we learn and are encouraged to use all kinds of tools. Our minds, our hearts, technology, and perhaps most importantly, our hands. We study concepts, but the most powerful gift is that we have each had the gift of engaging in experiential learning from mentors, asking questions, gaining field and hands-on experience, while developing our own sense of professionalism, confidence, and competence. Never take for granted that it is this powerful pairing of our hands and our minds which sets us apart. 102 muscles, 54 bones, 10 phalanges, 2 palms, 1 transformative experience. Congratulations.
Thank you, Sophia.